Pancreatic cancer has stricken a number of famous people in recent years. Actor Patrick Swayze, Supreme Court Justice Ruth Bader Ginsburg, and recently, Apple founder Steve Jobs. Dr. Steven Steinberg of Boca Raton Regional Hospital is joining us now to tell us more about this often overlooked disease. Doctor, thank you so much for joining us.
Pleasure, Mike.
What is pancreatic cancer? Let's just define that.
Well, pancreas, as you probably know, is the gland that both secretes insulin and also digestive juices to help you digest your food. And cancers of the pancreas can come in several different types,
Sure.
as all diseases. There's the rather common type that has a relatively poor prognosis, and the other type, several other types, like neuroendocrine cancers of the pancreas, which is what Steve Jobs had, and that's much different in terms of the prognosis and much more often cured.
Kind of a two-part question here.
Sure.
What risk factors are associated with this disease, and also what role does family history play?
Well, smoking and much too much alcohol are among the risk factors for the more typical type of pancreatic cancer. And there is a family predisposition to pancreatic cancer, but it's not the same degree, for example, as breast cancer or colon cancer. In those diseases, we're interested in every first-degree relative, brother or sister, of people with colon cancer or breast cancer. In pancreatic cancer, the familial predisposition is less. The Jimmy Carter family is perhaps the most well-known, and we're only interested in people who have two brothers or sisters, two parents who have pancreatic cancer as being at greater risk.
Interesting to know that. You know, a diagnosis of pancreatic cancer is generally a poor prognosis, even if it's caught early. Why is that?
The reason is that early is a relative term, and oftentimes these tumors are silent. They've been there for longer than anybody thinks, and they also tend to spread early. So even if you get the primary location, you may not be able to easily get to the other areas that small deposits of tumor cells have gotten to.
I see. And if we're talking about the most effective treatment for this type of cancer, what would that be?
Well, I think given the course that I just described to you, you'd understand that the Whipple operation, which is the major operation that's been done since 1935 in this country, and while we're better and better at the surgery, we're still finally realizing that it's those tiny little deposits of cells that are spread that need to be dealt with if we're going to improve the outcome. And so we're starting to give people chemotherapy treatment and sometimes radiation treatment to deal with those problems of the disease. And with that kind of approach, our results are actually getting better. So we have people who are out 10 years with no disease who have been treated by that combined form of treatment.
Okay. And good to know more about this. We hear those famous names. We want to attach it to normal life here in South Florida, and looking out for your health this morning. Thank you very much, Doctor. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.